Thank you very much for the kind introduction and the invitation. I just share my screen and start the presentation. Yeah, we are pleased to present our recommendations, which were published in Complementary Therapies in Medicine already 2 years ago now. It was part of a bigger project which started in 2018 by the Scientific Society for Homeopathy. And we wanted to develop guidelines and recommendations for high quality research in homeopathy. Already in August 2020, the first article was published. This was about observational studies in homeopathic human medicine, followed by an article on homeopathic case reports in February 2022. And in 2023, the articles on systematic reviews and meta-analysis, on RCTs, and on observational studies in veterinary homeopathy were published, followed in 2024 by the guideline on basic research. And I think it's also important to mention that these guidelines can also be of use for complex medical systems like other complementary disciplines. To come to the background, I think we all agree that randomized controlled trials are an established research method to investigate the effects of an intervention, and several recent systematic reviews and meta-analysis of RCTs with homeopathic interventions have identified shortcomings in design, conduct, analysis, and reporting of trials. So there was a need for guidelines on this topic, and especially for individualized homeopathic interventions, there are some particular factors that are inherent to the therapeutic approach and have to be taken into account when planning an RCT. Namely, the individualization, so that a homeopathic medicine or product is selected for a given individual based on his/her individual symptoms. The case taking, which differs from most settings of conventional medical practice, but is similar to the biopsychosocial approach. Now we come to outcome and flexibility, as homeopathic treatment is considered to be an iterative process where HMP's potency, dose may be changed. It's very important to be flexible also in the study design. And the same is true for the outcome and the follow-up. Intervals, prescriptions need to be tailored to the individual course of the disease and the individual's general health status after the intervention. So what did we do? We identified homeopathy-specific requirements for RCTs by reviewing literature and doing experts communications. We then systematized our findings using a suitable checklist for planning, conducting, and reporting RCTs, namely the spirit statement. And then we did a cross-checking of the created checklist with the red hot criteria, the PRECISE criteria. And for veterinary homeopathy, we considered also the reflect statement and the ARRIVE guidelines 2.0. Now we come to the results as regard the literature searches. The key features of RCTs, according to the article of Kendall et al., were identified as being of the clearest structure and the most to the point. And these features should also comply as far as possible with the risk of bias assessment in a randomized trial as recommended by Cochrane or Circular, which is adapted for animal research. I think we are all aware about the typical items, key features of RCTs, namely that the study should address a focused research question in terms of PICO, so population, intervention, control, and outcome, that there should be effective randomization, as well as blinding of trial participants, clinical investigators, and statisticians. An intention to treat analysis should be done, just to name some examples. And for sure, the study protocol should be submitted to a clinical trials registry before the trial has commenced. Now we come to the specific items which are of importance in RCTs in homeopathy. To give one example, as regards the type of intervention and comparator, The homeopathic intervention is often not standardized due to the individualization, and different knowledge and skills of the homeopathic doctors can have a major influence on the result. Hence, the education and experience of the homeopathic practitioner needs to be described in detail in order to enable replication of the treatment. There are several other exemplary implications for RCTs, but this is too much for today. But I want to have a special focus on veterinary homeopathy, as these RCTs are more efficient, as in most cost efficient, sorry, as in most cases, insurance is not needed for study participants, and large numbers of farm animals can be treated under standardized circumstances more easily. And for epidemiological diseases in farm animals, the same homeopathic medicine product can be used for the whole herd, which can be treated as one individual. So we recommend independent replications of high quality RCTs in veterinary homeopathy. Another very important thing to mention is that HMPs in farm animal practice are often administered via drinking water. Thereof, the person administering the medicine does not come into direct contact with the investigated animals. Consequently, placebo effects can be excluded. And it's also important to say that homeopathic medicine products without indication, also those which we use every day, are similarly used in animals and humans. Thus, the basic considerations for veterinary homeopathy trials do not differ from the ones for human homeopathy trials. Now we want to give an example of questions to be asked and a detailed guidance for homeopathy RCTs. We come back to the type of intervention and comparator. We already said that the effect of the individualized approach may be influenced by the prescriber and as such difficult to reproduce. And in single prescriber trials, it's therefore appropriate to report the prescription method in detail. In case of multiple prescribers, stratification or randomization of the prescriber might be considered. Another solution might be the use of consensus of the experienced homeopathic doctors. And in semi-individualized approaches, the treatment can be reproduced more easily, but it is influenced by strictness of the prescription criteria used for the selection of the homeopathic medicine products and runs the risk of inappropriate prescription. You see the complex problems. There are some more examples, but yeah, I handed them in the slides, but have no time to go through all of them in detail. Now I come to examples of innovative designs for homeopathy RCTs. I already mentioned that the semi-individualized trials, they are designed to make the replication of treatment easier. They allow individualized homeopathic treatment with a limited number of homeopathic medicine products and use strict criteria for the selection of the homeopathic medicine product. So it's independent of the homeopath. The HMP selection is based on a questionnaire, either with symptom clusters, which indicate specific HMPs, or with processing of the questionnaire outcomes by computerized algorithm. The disadvantage of a limited number, we already said, is that only a proportion of the patients with the medical condition under investigation would benefit. And allowing free prescription of homeopathic medicine products at follow-up could partly solve this problem, but this renders blinding of the physician impossible. Another design which makes things much easier is the so-called selected condition, selected HMP design. In some clinical conditions, only one or few suitable HMPs are indicated and prescribed. It's so-called clinical or routine prescriptions and prescriptions in endemic situations, so the genius epidemicus. One example is the well-known study of Michael Fraß with Kalium picromicum, which was done at the Medical University in Vienna. To give an example from veterinary homeopathy, it's a study on prophylaxis of diarrhea in piglets. Mother sows were either given a homeopathic medicine product or placebo as prophylaxis. And E. coli diarrhea in piglets is in principle a well-suited and comparatively simple model to investigate the efficacy of one HMP in a RCT in a large number of animals under standardized conditions. There you can see our adapted spirit checklist, and you see written in bold and italics the specifics which are added by us, specifics for homeopathy. And in blue and underlined, there are cross-links. So you can click on the cross-link and you are led to a specific guidance where all these items are described in more detail. Now we come to the discussion. Although an RCT with placebo control is seen as the gold standard technique in clinical research, generating evidence of the efficacy of a medical intervention, this design may not be the most appropriate method for complex medical interventions. This was already said more than 20 years ago. But our review of literature showed that the conduct of such trials is still perfectly feasible, especially in acute clinical conditions or conditions with little therapeutic benefit from conventional medicine. And we emphasize to focus on the investigation of homeopathic treatment in daily practice. For example, with reproducible selection strategies for the homeopathic medicinal products, such as semi-individualized strategies, because these designs reflect the homeopathic method better and the results are therefore of higher clinical relevance. Add-on designs with placebo control or studies with standard treatment, best care as a comparator to the individualized homeopathic intervention as a whole may be further options to optimize generalizability. And in this respect, we recommend to consider the replication of successfully conducted homeopathy RCTs as independently conducted trials with the same research question increase the evidence of effectiveness. Further issues that were discussed are quality assurance and cost effectiveness. And now I would like to take you with me on a thought we integrated in this article, namely, firstly, as regards model validity, if the similar principle is followed, individualized homeopathic therapy is based on individual symptoms and not on indications. It appears, therefore, logically that this therapeutic method, if shown to be effective in one indication, is effective in other indications as well, as we are testing the principle and not the homeopathic medicinal product itself. Still, in order to have comparable interventions in different clinical studies, the homeopathy used in the studies needs to comply with homeopathic pest care and should be thoroughly reported in order to be replicable. And secondly, it was the unanimous opinion that for quality assurance of RCTs, adequate resources, namely a trained research team, preferably an academic research environment, and an independent financial backup are required. This was also the outcome of one of our quick checks of the articles published in the 4 systematic reviews, and it can be seen that only 20% of non-individualized and 28% of individualized homeopathy trials have been university-based or conducted in collaboration with universities. Hence, if the cooperation with academic institutions can be strengthened, which is our daily task force, homeopathy trials may be of better quality overall. With regard to cost effectiveness, we already spoke about the RCTs and in veterinary homeopathy and its advantages. And also the advantage of being able to exclude placebo effects by doing a trial in veterinary homeopathy and administering the homeopathic medicinal product via drinking water without any direct contact with the animal. To summarize, the question how to perform high-quality homeopathy RCTs remains complex, and their successful conduction roughly depends on 4 factors: thorough planning, congruency with the homeopathic principles, as well as general medical research standards, trained research staff, and sufficient financial resources. And in order to implement the formalized recommendations, each of these aspects needs to be given. The conclusions and highlights for today. The compiled recommendations may serve to better plan, design, conduct, and report RCTs in homeopathy, in addition to the spirit checklist, whereby the specific challenges of the individualized homeopathic approach needs special attention, including possibilities to reproduce the individualized selection of homeopathic medicinal products and to reflect daily homeopathic practice. And for tomorrow, the replication of RCTs increases the credibility and recognition of the results by the academic community and enables to conduct systematic reviews and meta-analysis of particular interventions. Hereby, the various innovative and previously tested designs that were presented in this paper, each one suitable for a different type of research questions, are to be considered. Thank you for your attention, and I'm looking forward to your questions.